Welcome to 24 Live webinar with the title Addressing Mental Health at Work, Tips for Leadership. My name is Eva and I will be host today. The webinars are organized by 24 Live, a world-leading corporate well-being provider. And since we all strive to help to improve the health and well-being of the people, organization, and society, we gather the world's most forward-thinking health and wellness experts and industry leaders for insight of different corporate health-related topics. Our goal is to provide valuable and validated information, experiences, and good practice to you, to corporate leaders, and to anyone else who can benefit from it. Another critical topic, in my opinion, that crucially needs to be discussed is mental health at work. Work, including working conditions, are one of the key social determinators of mental health and one of the primary sources of stress. But when it comes to mental health topics, I figure out that most organizations are struggling with how to address them. Workplace stressor is a universal concern of both workers and employers globally. So how to create a psychologically safe environment which will lead to better performance and will protect employees from several psychosomatic diseases, resulting in lower rates of absenteeism and presenteeism, and not to mention the benefits of having productive and engaged people at work. So I'm really delighted to host Dr. Amit Sood to discuss these important topics together, because we know that no one size fits all cannot solve the mental health issues at workplace. So let me first introduce my distinguished guest, Dr. Amit Sood. Dr. Sood is one of the world's leading experts on resilience and well-being, and is a former professor of medicine at Mayo Clinic. Currently, he serves as an executive director of the Global Center for Resiliency and Wellbeing, and is a member of the Everyday Health Wellness Advisory Board. Dr. Sood was also a chair for student life and wellness at Mayo Clinic. And in addition, our WJ Foundation selected him as one of the healthcare pioneers, and he was also awarded by Biggest Impact Maker by Rochester in healthcare. He also received the recognition as an outstanding physician scientist from Mayo Clinic. I can say that Dr. Sood's research contribution is impressive and significant. He has authored or co-authored over 70 peer-reviewed papers, and he's author of several books, including Mayo Clinic Guide for Stress-Free Living, the Mayo Clinic Handbook for Happiness, Mindfulness Redesigned, Smart with Dr. Sood, The Resiliency Journey, and Build Your Immune Resilience. Dr. Sood is also an author of the best-selling program, Resilient Option, which guides and educates people how to become more resilient. Dr. Sood, welcome.
Thanks so much. Very grateful to you, Eva, for hosting me, and I'm particularly grateful to all the participants for trusting us with your precious, precious time. We know how precious your time is, and an hour is too long to take, too big a chunk to take out of your day. So we are very grateful, and we'll try to make it meaningful for you.
Thank you. So Dr. Sood, let's start at the beginning. You're a physician. So do you agree that health defines as both physical and psychological, not to divide those two?
Oh, absolutely. I'll completely agree. And actually, in the light of the headline news right now, the pandemic, when you look at studies, if you have an unstable psychological condition, you are 8 to 10 times at higher risk of developing COVID infection and 2 times increased risk of hospitalization and mortality. So clearly there's a link between physical and psychological health. Psychological health improves physical and physical improves. They're all part of the same equation. That is me, that is you. Right. So when you say psychological, I'm assuming you're also meaning you're meaning mental, which is cognition plus emotion. Cognition is your attention, your focus, your ability to get information, remember it, your judgment, your decision making ability, your ability to handle complexity, uncertainty. That all is part of cognition. And emotion is what you feel. And guess which organ in the body hosts your cognition and emotion? It's your brain. Just as your heart and blood vessels generate your blood pressure and perfusion to the body, your brain hosts your cognition and emotion. So when we are talking about mental health, psychological health, we're talking about the health, the well-being of your brain. And I'm sure you'll agree, if every person with a brain will acknowledge that the health of their brain is part of their physical health. So absolutely, yes, health includes physical, cognitive, emotional, social, and spiritual.
Perfect. So when organizations are trying to improve the health of their employees, they should also focus on the mental health. So the workplace mental health strategy should be a new norm, even now after or during those pandemic times. So what would you say, where to start?
Yeah, so there's always been a little bit of sprinkling of ideas to improve people's cognitive and emotional health, but this is taken, as an urgent issue at this point. So where to start? I usually follow a 3-step format for most personal problems and most personal strivings. And the first of that step is to recognize or identify. So identify what is the state of my employees' emotional and cognitive health at this point. You can do that by surveying. You can do, of course, you can benchmark to the national standards and so on. And also identify what are the barriers that are preventing my employees from thriving. So the first part is identify the problem. And the second step usually is to eliminate or remove any dissatisfiers. Is there cognitive overload? Is there emotional overload? Is there physical overload? Are they sleep deprived? Are they coffee deprived? Am I providing the right rewards? Are my communication systems good? Is the leadership engaged? Leadership sending the right message? Do they have the right resources to thrive? Am I providing them a right trajectory for progress and growth? Is my environment safe? So basically everything you can do logistically to help your employees. And very important right now is, are they getting telehealth services, telemental health services? Do they feel secure in their job? Now, after you have done that, or concurrent with that, the third part is building resilience, ways to reframe. So you can offer this through a variety of programs. They include on-demand programs, live programs. They include video-based programs, in-person training. The broad theme is, whether it's mindfulness or resilience, meditation, positive psychology. You basically offer a cafeteria choice to people to pick the ideas that resonate best with them. And once you have done that, you test people's engagement, their perception of whether it is working for them or not, get their feedback and act on that feedback. So that's how I would approach creating a culture of resiliency and well-being within the organization.
And we can see that there are countless workplace policies to keep employees physically safe, which of course is correct, and we encourage that policies, but we have the lack of policies and systems measures to protect mental health. And that's very evident when working on the field. And when I'm talking with organizations, they don't have even an idea what means a psychologically safe environment. What would you say that is psychologically safe environment?
Where, that's a place where I am not ashamed of sharing that I had a mental health breakdown yesterday while talking to my teenage daughter, perhaps, or after that, just as I'm not ashamed of sharing that I have an autoimmune condition or develop back pain or have arthritis in my right knee. So we treat them equal. We're not there yet by any means. I mean, if I ask you, how many of you will be completely comfortable sharing at your workplace that you have a mental health issue? at this point. You know what percentage of people say they will be safe sharing that? Less than 5%. Less than 5%, according to a large survey. So most of us are not feeling comfortable, and then we don't seek help. More than 50% of people with depression, moderate depression, do not seek the help that they need. Right? So how do you create a safe environment like this? It starts with the leadership. And so we started a very nice, in a medical school where I was the director of well-being, we started a program called My Story. And there we would have senior leaders come and every couple of weeks share their story of mental health issues, their story of relationship struggles, sometimes substance use, sometimes, getting drunk at the wrong age, and so on. And they shared how they struggled through it and how they conquered it. And that really validates people. So it starts with leadership and validation. And then, you create this culture of equality. You create culture where there isn't hierarchy, and you do not punish people for mental health issues. You secure their job, provide them the right resources to recover, and so they do not worry when they come back after recovering that they will not have a job. So having policies, providing validation, and not distinguishing between physical and mental challenges will be a great place to start.
I can relate, Dr. Sood. I have a toddler at home, trouble too, so and the lack of sleep, it's also my issue. But if we explore further, your field of expertise is burnout, the clinical symptom of burnout and its treatment. We know what are the classic risk factors for burnout, but the pandemic just added on. So those factors didn't disappear. There are even more factors if we talk about hybrid working, instant communication, lack of work-life balance, etc. And all those factors are an excellent foundation for burnout. And what about digital exhaustion, Zoom fatigue? Can you talk more about this?
So go back to 2015. Were you working 6 inches away from 10 people for 10 hours a day, all day long? That's how it feels right now, because we are just maybe about a foot away from each other. And in older times, that meant we were about to, fight with each other. It became so close. And constantly, as I am talking to you, I can see my image and every movement I monitor. And if I am sort of sensitive to being observed through an all-day meeting, then I have to maintain this decorum for professionalism all day long. Every little movement can be recorded and then used. So that creates tremendous cognitive and emotional load. Research says, how long does it take for the brain to get tired when you're really focusing on something? It's about an hour. So if your colleagues, all those who are watching right now, if they have not chosen to rest their brain by 9 or 10 a.m., all day long, they are working with a tired brain. That leads to what is called as Zoom fatigue. And just the other day, actually, the CEO of Zoom himself said that he is experiencing, Zoom fatigue. So anyway, so that's what is happening right now. And so our brain is, and our eyes in particular, are experiencing tremendous cognitive and emotional overload. Emotional for the brain, but eyes have to strain, which leads to eye fatigue. Things start blurring. You're not able to focus. Even the blink rate goes down. When you're staring at screen, you do not blink as efficiently, as frequently. And the efficiency of each blink, because you blink quickly and you want to see, you don't want to miss what you're seeing. So I think giving yourself the right kind of break, being comfortable with not projecting your image all the time. I envy everybody who's watching right now, because we're not seeing you, so you can be just yourself. But I cannot be myself, perhaps. No, I'm okay with that for now. But if I did all day long, I'll be struggling. And I think the other part is how you connect with the video interface. So one simple practice I use is I try to send, and this may sound a little cheesy sometimes, I try to send a silent good wish to people in front of you, in front of me. So for example, Eva, you are in front of me right now. I just don't see you as my colleague. I also see you as someone's sister, someone's spouse, a 2-year-old's mom, a niece, a granddaughter, a future grandma, perhaps at some point, right? So when I see you that way, I see a very different you compared to feeling vulnerable in your presence by feeling that you're judging me, right? So I try to send a silent good wish to that you. So you respect people for what you do, you honor people for who they are. We can do this very simple practice right now, because we can't see all each other. Everybody has a cell phone, right? You take out your smartphone and you go to your photo stream, and you please do that too, Eva, and pick out picture for somebody who you care about, who you see in the picture, and just try to zoom in into the eyes of this person and send that person a silent good wish for being in your life. And just by doing that, you gave yourself a little, you interacted with the screen slightly differently. And so, and we have a lot of these small practices with which we try to sprinkle what we call RAM moments during the day: rest, uplifting emotions, motivation. And that breaks the fatigue that happens from digital interaction.
Yeah, thank you for that lovely exercise. I'll remember that for the next Zoom meetings I'll have. But if we stay in this digital area, let's say, the more digital work and the stress of living in current situation, the pandemic has left many people, employees, feeling overworked and disconnected, while of course some groups suffer more than others. And we experts are really emphasizing that after the COVID-19 pandemic, it looks like the mental health pandemic is on the rise. So how can HR department consider and set some appropriate measures and policies to target those groups, unique groups, and to meet their needs? Because as I mentioned, one size doesn't fit all, right?
Absolutely. I think the connecting point there is, what is the single most important tool that you're using at your workplace? Single most important tool that you have. It's yours and your colleague's brain. So I think if we focus on brain centricity as we plan solutions, that will help. So from that broad perspective, I see that people are, and my apologies for really categorizing people, I don't like to do that, but broadly, there is a proportion of people who are in crisis, who are in real duress. And these people who are there have genetic predisposition, perhaps they had adverse childhood situations, and now they have a huge expectation reality mismatch in adult life. That could be 10, 20, 30% people. There is another 10 to 30 crazy people who are just thriving no matter what. You just throw anything at them, they'll be fine. And I envy them, and I admire, sometimes I'm inspired by them, but those people they are doing fine. The middle big group, there was a very nice recent New York Times article by Adam Grant, one of my colleagues, with whom I am a scientific advisor at a coaching group, and he talks about languishing. Corey Keyes had coined that word. So languishing is the big middle. There's a lot of people, maybe 50 to 80% people are just languishing. They're not, I mean, it's just foggy, right? It's not bright and sunny. It's not, dark and thunder cloudy and rainy. It's just foggy. There's almost like a cobweb on my brain. So you think about these three groups of people. For the thriving, find why they're thriving, let them thrive. For the real people in crisis, they need professional help. The big middle, follow the same framework I was sharing with you. First, identify why are they struggling? Why are they languishing? Are they insecure about the work? Is their work not meaningful for them? Do they not have the right insurance? Do they have childcare issues? So basically identify, because it's a lot about customization and having local managers, local supervisors. So the CEO can't do everything. It's really at the local micro level that these things are best managed. The best organization, that's what they're doing. They're really delegating a lot of power and a lot of resources for the local areas to be helping. So identify what the problem is, and then offer both logistical solutions, optimizing load, providing the right kind of work, providing the right communications, providing the right health insurance, mental health insurance, etc. And then well-being solutions. Well-being within the mindfulness, resilience, meditation, that sort of domain. Those resiliency solutions can be on demand, can be in person. You can have coaches within the program. Certainly people engage with EAPs and such. So, but make sure you offer a variety of different ideas so that people find at least something that they can engage with the intermediate goal of creating an ecosystem of products that people have access to. And the eventual goal is to create this culture of resiliency, culture of well-being, culture of thriving within an organization. So it's like you aim to build a 20-story building. You start with 2 stories initially, and approach methodically as you are pursuing this to set yourself up for long-term success.
I like what you mentioned, that the best possible solution would be to eliminate the stress, but that's pretty unrealistic. But the other option is what you've mentioned, to understand the sources of stress and to focus on that source, how to solve the problem. So to develop different strategies, coping skills, and of course, to lift our capacity, to increase our capacity, which is resilience. And I know that you are also the author of the Resilient Option Program, which I just finished. But I would ask you if you can tell us more about the program, what was the idea behind, and how did you design it?
Yeah, sure. So just to respond to your comment, we cannot eliminate stress. Stress is like friction. It's like salt in my soup or honey in my herbal tea, right? I need a small amount, but if I put 4 spoons of salt in my soup, then it won't taste good and it won't be healthy. So we need optimal good stress, not bad or ugly stress. So Resilient Option Program, you asked about, it's a program we developed after over 15 years of research, understanding the human condition. So what we try to do is we do it in 3 steps. The first step is we take you on a backstage tour of the brain to help you understand what brain mechanisms create and multiply our stress. So we talk about our neural challenge with wandering attention. We talk about cognitive fatigue, and then we also talk about negativity bias, the focus, fatigue, fear. Those 3 challenges create and multiply our stress, because I feel our brain was not designed for happiness and peace and well-being. It was designed for survival and safety. So we're trying to use a tool that was designed for survival and safety to deliver peace and happiness and well-being. So we'll need to do something. And I mean, just as you wouldn't drive your car without knowing how the steering wheel operates, you don't want to live your life without knowing how the brain operates. And I would love for people not to feel like, I wish I knew this 20 years ago, which I keep hearing all the time. And so the entire science related to that, we can share in about half an hour, and sometimes it can be transformative. So that's the first part, awareness part. The second part is attention. Attention is the main single most important tool we use to live our life. I mean, it's like when you go to a restaurant and you look at the menu, it has like 200 items, but how many can you order for yourself on the table? 2 maybe, right? So basically your experience of dinner is not what's on the menu, it's what's on your table. That's what your attention does. Your attention converts this terabytes of data from the world into what makes sense to you, what is nurturing for you in this moment. That's what, so developing this intentional attention. And so we sprinkle the days with multiple moments of intentionality, where you develop intent, because you can't be intentional all day long or even for an hour. Our brain cannot do that. But for 2 minutes, for 3 minutes, you can develop intentionality. And we have over the years learned how to sprinkle intentionality at the right moment, like when you wake up in the morning, when you come back home at the end of the day, when you see a person. So over a period of time, these sprinkles, so the way I see is, we are not adding more milk to your glass of milk, we are putting chocolate powder in the milk. So these sprinkles add up to sort of lift your entire day. So that's the second part, attention. And the third part is attitude or mindset. So awareness, attention, attitude. And mindset is, again, developing a resilient mindset, which is one guided by your core values, gratitude, compassion, acceptance, meaning, and forgiveness. It's very important for us to be focused on our own values rather than be taken by someone else's, invitation to take the bait. Many times when I'm struggling with something, I keep, or someone has sent me let's say a negative email, or someone has, followed me on social media and posted a nasty comment, the words that ring in my head are, don't take the bait, don't take the bait, Amit, don't take the bait. And that's so important, because I know I'll sound judgmental here, but because, as they say, don't get into the mud with the pig, because you'll both get dirty and the pig will love it. So those are the three components: awareness, attention, and attitude. And we try to sort of share that entire theme in a couple of hours, and the practice time is 5 to 10 minutes every day. We've done over 30 clinical trials now, Eva, and reached over 1 million people with this approach. So thank you for asking.
I'm also happy that we include your program into our solution, our corporate wellness solution, and we're also able to offer such a solution to our clients. And I have that privilege to be able to closely collaborate with those clients. And I can tell you that results are always outstanding, because your program is formed in a way that it has a pre and post assessment. And I always try to encourage people, to motivate them to try together, work toward common goal, to lift our group resilience, not an individual. So we always prepare how we start and how we finished. And I can say that we can lift up resilience to 10% and even more. But I think it's more important now what the scientific studies are saying. And as you mentioned, there are plenty of studies backed this program. And I'll be happy if you can share some findings with us.
Yeah, yes. First of all, I'm grateful to you and 24 Alive for choosing to integrate this program in your platform. You have an excellent platform that you offer, and I think the way you have laid it out, I think that's great. Talking about studies, so we have done over 30 clinical trials, many with the on-demand component of the program, and many others have done similar studies. And if I have to use one word, and that is, look at the online programs as educative, but not. I don't go to online programs for inspiration, for being inspiring. The best way to be inspired is live, when you're talking to someone, when something is happening in front of you. I look at online programs, on-demand programs, which have made things much less expensive, much more accessible as a source for education. So educate, be inspired, implement in your life, and come back, be educated again. And we have found at least the effect size, as we have seen in research studies, both with us and a number of other groups that have tested this and similar programs. They've consistently found that they help people's resiliency and well-being and other like health behaviors and engagement and creativity and so on. What program will work you the best is the one that aligns with your values the best, the one that you find most easily accessible, the one that is scalable, the one that is simple, and so on. At the end of the day, I feel it doesn't really matter what you choose as long as you choose something. And because people who are putting these programs together, they're working very hard to bring these solutions. And um, I must share with you that I've had people who have gone to a lot of different vendors and a lot of different programs, and almost never do I say, oh, that was terrible. Everybody's happy with what they do. And I'm so happy to see that. I'm so happy to see that this world has so many different solutions now for people to access, and so many different people are putting their creativity together to bring these resiliency and well-being solutions to the much needed audience. And I don't see anybody as a competitor. I see us all as collaborative, because at the end of the day, it's one earth. Your 2-year-old Eva will play with my 10-year-old at some point. So if you are happy and you are a good parent, it's helping me at the end of the day. So I see us as one single planet, and I see your child as my child. And I think if we have that kind of camaraderie and compassion for each other, we'll build a much better workplace and a much better world.
Exactly. And there is one thing that always reminds me when I'm talking about your program or presenting it. I know there was a study in which you found that in general, about 13% health in 30% the healthier behaviors appear. And some of the people ask me, why are you talking about that number? But I think that's a pretty nice side effect of the
Side
program.
effect, yeah. So it's interesting because I think I have valued my life much more once I became a father, once I had more responsibilities. And I value my life even more if on days I feel happier, on days I feel I'm fulfilling a purpose. And so what will I do when I value my life more? I will eat healthier, I'll be more physically active, I'll try to sleep on time, I'll try to be kind to myself. So what we found, and that was an afterthought, we said, oh, let's see if when people's resilience improves. And by the way, 10% improvement in resilience translates to 20 to 30% improvement in stress and anxiety. So moving resilience is a very, very desirable and very predictable sort of outcome that can have a very large, downstream impact. So as we were doing this study, so, oh, what will be the impact on health behaviors? Well, people, and we don't talk about, one of the most boring things that patients say to talk with a physician, it's when physicians start talking about diet and exercise. Patients don't like to be told. Patients as such don't like to be educated. They like to be validated even more. That's my understanding. But anyways, so when we studied that, we found that people who became happier and more resilient, their self-care improved, their health behaviors improved. We also found this in an observational study with 2,000 corporate executives who had come to Mayo, that that positive measures on resilience and stress very strongly correlate with better physical health and better self-care.
Mm. And in your program, what I think it's also very beneficial, you provide not just education, but many, many tips and exercises that can be implemented in daily life of the people, and also in organizations. Can you share, please, one of those, maybe your favorite ones, that can be also used in organizations?
Sure. This will be a short meditation. But before that, what I'm reminded was I'm very inspired by a Greek orator, Demosthenes. So I don't know if you're familiar with him. So when Cicero spoke, who was in his time, people said that was a good speech. When Demosthenes spoke, people said, let's march. So you're absolutely right. For us to provide a high-sounding theoretical construct with this model and that model, that will be great. But if it doesn't translate into something meaningful that people can do every day, which improves their personal well-being, their focus, clarity of their mind, their relationships, then what's the point? So we have many skills that directly come from science that are very short that people can integrate in their life. So one of the skills that I like, which is also a short meditation, is what we call morning gratitude. So morning gratitude is when you wake up in the morning. Typically I would wake up and these guys will greet me first thing in the morning, and I'll be like, what should I do? What should I trade? Check my emails. Immediately I've given back control of my attention to the world. And I realized that a few years ago that maybe that's not how I should wake up. I should keep control of my attention with me. I should be intentional about how I engage with my first few minutes, at least in the morning, before the world takes over. And so tried a lot of these ideas until developed this technique that we have now been testing and have implemented in all our programs. So maybe if it's okay with you, I'll take you through,
Yes.
and everybody through this practice. If you're, I'm assuming you're somewhere safe and you can close your eyes. So if you can, I invite you to close.
Perfect.
It's going to be short, and it's not
Okay.
going to be I hope you like it. So please close your eyes and bring a smile to your face and relax your eyes. Imagine you are waking up in the morning. Try to recall the color of the floor where you woke up. Now think about the first person in your life who matters a lot to you. Recall that person's face, smiling face. And then send that person your silent gratitude for being in your life. Second person. Go back to the first memory of this person, the first time you saw him or her. Then send your silent gratitude. Third person. Look into the eyes of this person and notice the color of the eyes. Then send your silent gratitude. Go back in time and look at yourself when you were a little child at a happy moment, perhaps when you were an 8-year-old, your birthday party or something. Recall your hairstyle at that time. And then send a warm hello to your happy, innocent self. Think about someone who has passed away who you loved. Give that person a virtual hug. And then send silent gratitude to that person. When you are ready, you can open your eyes. Okay, so this is how I like to wake up first thing in the morning. And the details of the people, whether you felt relaxed or not, may be less important. What is important is that you woke up intentionally. You see, even more important than being in the moment is to be intentional about how you engage with the moment. That's the key to mindfulness. Mindfulness is often misconstrued as non-judgmental present moment awareness. That's not what it is. It is intentional, compassionate engagement. I don't know how to be non-judgmental because my brain judges. It has to evaluate things and come to conclusions. And I don't know how to be in the present moment all the time because I have to be in the past or future. If my wife says, what's planned for Friday, I can't say I'm in the moment right now. I'm sorry. And I don't want to be in the moment when I'm getting done with work. So I want to zoom out. So it's really about intentionality and it's about compassion or kindness. So, and it's not a practice, it's really a way of life. So sometimes we create rigid, impractical constructs for people that sound good, but where the rubber meets the road, they don't work very well.
Thank you so much for this practice. I think we will all use it more frequently to start the day properly. And when we are just talking about, the brain health, mental health, those issues or problems are often invisible. Even people put a lot of effort to hide the psychological pain. And it's often hard to see depression, anxiety, or burnout physically. Many HR managers or CEOs are concerned and are asking me, how should I know that something happening? Because I don't see that. So how can leaders recognize or what they can do to detect stress and stress-related issues?
Amongst your about 2,000 participants today, about 600 have micronutrient deficiency. You don't even know it. You have a subtle deficiency of vitamin D or vitamin A or vitamin C or riboflavin or B12, or zinc, I don't know. You do it by screening for it. You do by trying to actively look for, similarly, hypertension is asymptomatic unless you go look for it. If you assume that, okay, as long as I'm asymptomatic, everything is fine, then by the time we discover a problem, it's too late. So I would invite leaders to go look for the health of the folks that you are serving. And it often starts with, because, go back to the mental health being equal to brain health. What happens when your brain is not really fully healthy? Engagement goes down, productivity goes down, creativity goes down. You are not as cheerful, you're not as collegial, you're not as professional, right? And then you start falling sick more often. You get upper respiratory infections. Very interesting study, high stress, the same virus exposure, much more increased risk of infection. Very important in the light of COVID, that if you have high baseline stress and you're exposed to COVID virus, you're much more likely to get an infection and have poor response to vaccination. I really want people to know that mental health is also about having good vaccination response and having enduring immunity. Multiple studies have shown that. And so there's a whole theme called immune resilience that we have tried to develop to help people integrate some of these well-being ideas to service their immune system. So coming back, and then there are, of course, measures of well-being, measures of stress, measures of burnout. So there is this whole cadre of assessment tools that you can use to gauge if sometimes at the earliest level, if there is deterioration in mental health, morale, hope, courage in my employees. And I think every organization should be implementing those tools and taking actions because what about a third of the people right now are fully engaged with work? So think about this: if your engagement metrics goes from 30% to 90%, would you be, if a company was to deliver 100% efficiency, will you be okay with or a machine, will you be okay with it delivering only 30% of efficiency? If 70% of the time you turn on your computer, it doesn't turn on, or your car doesn't turn on when you press the button or put the key in ignition, you won't be liking that car, right? You'll go complain to the dealership. But that's what is happening at workplace. And it is happening largely because of undiagnosed, suppressed, non-accepted mental health issues, which totally merit, it makes all kinds of business case to address those.
But Dr. Sood, what do you think, what we can do to reduce the stigma about mental health, brain health, psychological topics, to create a supportive workplace culture, to build a resilient organization?
Validation. I may have mentioned that the experience with my story, when leaders come and share their own mental health issues, and validate people and do not distinguish between back pain or depression, and consider both having strong biological underpinning, which they do, then that is a very important part. Even things like hope, things like gratitude. So there's something called CD38, which is oxytocin receptor gene, and people who are low on CD38 are less likely to be grateful. So someone who doesn't send you a thank you note, do not get upset at them. Just imagine that they have low CD38 and be okay. And I'm not saying be okay with it, but recognize that there's a lot of biological underpinning to our daily behaviors. So that's one part, validation. And one of the best ways to come to validation is through science and education about science. When particularly neuroscience. See, heart was the last 50 years story was the cardiovascular health. And we have devised a lot of state-of-the-art cutting-edge solutions for heart disease, both preventing and treating. Next 50 years are going to be brain. And more we will try to understand how brain is hosting some of these daily behaviors, productivity, engagement, creativity, and other aspects. So the more you can understand and integrate science and educate about it and validate people using scientific constructs, and at all levels, I think that's the key. And at the same time, you create this culture of equality. I don't know, do you know if you what is the dollar value of human body, all the elements in human body? It's about $4.50. So if we were to sell all the calcium and iron and water that is part of our body, so we're all about worth $4.50. That's it, $5 at the most. So if you are taller, so anyways, so basically we are all equal in many ways. And how you find equality is by doing two things. One is to respect people for what they do, and two is honor people for who they are. Right now we are focused just on what people do, but I think if we look at every worker who comes has a story, and at least at the local manager level, I should know that my colleague has two sons or has a mother who is whatever they feel comfortable sharing. So basically knowing everybody's story starts, you feeling everybody's relatable. I had a colleague, Bob, and we shared an office space. I mean, he was two offices, down, not shared, but I mean, we would just say, hi, Bob, that's how we would do. Once we sat down, and that was an exercise where we had to share each other's story. And it was transformative. When I came to know a little bit more about Bob, then he was not just this another person, hi, Bob. I knew who I was saying hi to, because I knew his dreams. I knew which village he grew up in, that he was a milkman, and how he found his wife. And so knowing everybody's story is an excellent way, because as they say, universe is not made of atoms, universe is made of stories.
Nice, but we agree that investing or creating a workplace wellness program is investment, not a cost. Sometimes I struggle when I need to speak the language of chief financial officers or CEOs, asking me, okay, if the levels of anxiety decrease, what that means in terms, of financial perspective. Do you have any insights on this?
Yeah, cost is something which you are not likely to recover, but if you look up the literature, for every dollar invested in well-being, you get back $2 to $5. I mean, all the metrics you see, someone quote $300 billion. Some people quote $2 trillion if you were to include all the cost of mental health, its impact on work, so about 10-12% of the economy. So we all will agree that there's huge cost to pay for disengaged, unwell workforce, which is the present case, unfortunately. So creating these programs, several studies have been done that have looked at the return on investment. And so for every dollar, it's $2 to $5. You know, what is the cost of one physician burnout? It's about $1 million. So for a small to medium-sized facility, if you have, let's say, half the well-being budget, if you could prevent one physician burnout in a year, you have more than paid for the cost of offering these solutions. And not to talk of, we know that, for example, workers who are happy have lesser risk of divorce. Even when a worker is feeling respected at work, valued, and secure in their job, their kids' grades in school go up. So I do not want my colleagues' kids' grades to go down. I don't want to be responsible for that. And that may be a simple enough realization to be kind to your colleagues.
So if we conclude with the positive side of psychology, I know that you're also an author of the Mayo Clinic Happiness Handbook. What can we do to create a happier tomorrow?
You know, I thought you would ask a tough question. So I have 4 pieces of chocolate with me right now. So there's three things I can do. I can eat all 4 chocolate, Eva. I can give you all 4. In the first case, I'll be happy, you will be disappointed. In the second case, you will be happy, I'll be disappointed. But I think it's better to give you 2, and 2 I keep for myself. So I think that's what we have to do, a culture where we take care of ourselves while we also take care of others. So this is called otherishness. You're not being impractically selfless, but you're not being selfish. And this is also coming to the current times where sharing PPEs, sharing vaccines globally, sharing, we are, you know, this is one earth. So creating that kind of culture. I'm reminded of a story, an old story I heard while growing up. And this story was about, there's a leader and someone brings him up a very ripe and juicy mango. And he looked at it and he says, here it comes to me. And so his student asked, what happened? He said, I had this mango 10 days ago, someone brought to me. So I gave it to my wife. And I knew that it will circulate the entire village and come back to me. So his wife thought, it is such a nice mango, I'll have my brother eat it. Her brother gave to his spouse, who gave to her sister gave to her neighbor gave to a child gave to somebody, and now the mango has come back to me. So that's the kind of culture where we find contentment, we find hope, we find healing through healing each other, through caring for each other. I think that's the kind of world we need. And I will be feeling very secure and delighted when I leave my kids and your child and everybody's child in that kind of world where everybody loves them as much as you do or I do to our respective kids. And we don't need a whole lot of technology there. We don't need Mars rovers there. We don't need major, we don't need to blow up 1 million Bitcoins for creating that kind of culture. It's very simple. It's very human. It's going back to the core. So through creating such compassionate world that is full of hope, that is full of courage, and that is full of inspiration, I think that's where we should lead. And technology should support that. Technology should not come in the way of that. Technology is like furniture. In a good room with furniture, you forget the furniture. It goes in the background. Similarly, technology should not become the end. It should become the means. It should, after connecting us, it should just go in the background. So I think I think I wrote some time ago that the pursuit of happiness has not made me happy. I found great happiness in pursuing I found great happiness by pursuing gratitude and compassion. So the pursuit of gratitude and compassion will make you happier than the pursuit of happiness itself.
Perfect. And I agree, this is the world we should and can co-create together. And before I say thank you, Dr. Sood, we have some feedback and some questions for you. The first thing I would like to emphasize is that the audience is saying a big thank you for the exercise, the morning gratitude practice. They appreciate it. But one question we also have is that if you can talk about brain fog and memory issues associated with mental health.
Yeah. So what happens is that in your brain, there's an area called hippocampus. Hippocampus is one area of the brain where your neurons are multiplying all your life. And that's how you make new memories all your life. And it atrophies when people develop dementia. So when there is too much adrenaline in your system and noradrenaline in your brain, it is very toxic to hippocampus. And so it starts killing neurons in hippocampus. And that is why you're not able to remember recent information, and things that you've remembered, you're not able to recall that information that easily. And that's why they say stress makes us stupid, which is sort of true. Stress is actually considered a reversible neurodegenerative disorder. So excessive stress, and I'm sure that has happened to you. When you're highly stressed, you can't find car keys, they are right in front of you. And sometimes my wife would pick it up and give it to me, and she calls it male pattern blindness, that you can't see what is in front of you, right away. So basically, any high level of stress will hurt your focus, hurt your ability to handle complexity and uncertainty. But all of this is reversible. All of this is reversible through making the right choices, through cutting the noradrenaline in your system, through optimizing dopamine, serotonin, and endorphins, and oxytocin, the right chemicals, which basically impact how your genetic expression is, how your immune system is operating. The basic idea is this: from your genetic and immune standpoint, what the message you want to give to your immune system and your genes is, you know what, I'm having a good life on this planet. I want to be on this planet for a long time. If your genes and your immune system are hearing that I'm having a very bad time on this planet, they start planning for your early departure. They increase your inflammation, they decrease your immune surveillance, they decrease antiviral immunity, anti-cancer immunity. But if your genes and immune system hear that you're having a good time on the planet, then they decrease inflammatory response, they decrease clotting of the blood, they improve antiviral immunity and such. So tell your genes and immune system, I'm having a good, meaningful time. And good time doesn't mean I'm partying all the time. It means I have a strong sense of purpose. Because if you go to a party, if you are the DJ or the host, you will stay for a long time. So assume that you have a strong sense of purpose, and your genes and immune system will follow.
Thank you. And one more question. I'll just read it. The passage above calls out human resource leaders to address wellness programs. Still, as a workplace strategy expert, I'm convinced that corporate real estate and facility management leaders should be on the front lines to address these issues as a part of their reopening plans. I believe the wellness is about the total workplace environment. What are your thoughts about how to drive this message?
Oh, this is an important message too. Your environment has a huge impact. We know, for example, biophilia, when you're surrounded by life and movement, you feel happier. In one study, walk through the nature versus walking through the mall. Walking through the mall got people depressed, while walking through the nature lifted their mood. The caveat was people who walked through the mall were not allowed to buy anything, which will actually depress your mood. Sometimes even windows that show nature might increase survival after MI, decrease pain, improve outcomes after surgery. And we know there's a company in Rochester, Minnesota that is pioneering the idea of the whole workspace in terms of the lighting, the color, the fragrance, what is the right temperature, how it should change during the day, etc. There's the whole well-being certified buildings approach, and they have found that your productivity, your mood, your engagement changes with changing environment. And so, yes, I think that is important, but keep in mind that there is a ceiling effect to all of these, because if I'm in the best of places, I remember many years ago, I was in clinical practice, I was under a high level of stress, and I was driving up, and right on the Pacific Ocean, there was sunset happening. Everything was as gorgeous as you can imagine, but I felt miserable because my mind was just not there. So any external intervention you do, any extrinsic reward you provide will have a ceiling effect unless people's intrinsic reward system is active and unless people's minds are in the right place. So that's how I am focusing. My personal effort is more on helping people from their mind perspective, from their intrinsic motivation, and of course from resilience perspective.
Thank you so much, Dr. Sood, for all those valuable informations and insights. To respect the time frame, your time and the time of our audience, I will say loud gratitude and thank you to you. I enjoyed so much, and now I think 1 hour will just pass by, so we need also to give our brain some time to rest and to rethink what we've heard. So I will say thank you so much in the behalf of the 24 Alive team. We're happy to host you and to hearing you soon. And also my big thank you to the audience who participate this webinar today with us. And if you have any additional questions, please drop us a message. If you have any additional questions for Dr. Sood, you can always leave them. We'll try to answer that as well. But anytime you can just contact the 24 Alive, myself or the team, and we are here to help you, and we want to do so. So thank you so much, and thank you so much, Dr. Sood.
Thank you, Eva. I think I will leave with one selfish message, and that is that the world is really struggling. There's many parts of the world struggling with the rise in pandemic. Many countries, whatever you can do individually to help, whichever part of the world you feel most connected to, in whatever little way you can do, I would urge for you to engage at a global platform the best you can. Thank you.
Thank you so much.